Thanks, Debbie, for that wonderful overview and for getting us started. My task is to provide 2 obesity solution opportunities. Solution 1, implement regular monitoring of nutrition and physical activity policies and practices in licensed early care and education settings in all states. We need to know much more about obesity prevention efforts that infants, toddlers, and preschoolers are exposed to in early care and education settings. That information would enable state child care agencies, as well as such relevant federal agencies as Agriculture and Health and Human Services, to assist child care programs in providing more effective obesity prevention for our children. As you may know, and as Debbie said, some states are considering inclusion of specific nutrition and physical activity standards in their quality rating improvement systems. Having more precise and timely information about current policies and practices would provide critical information to these agencies and contribute toward important federal and state changes and guidelines for obesity prevention. An early care and education monitoring initiative could be modeled after the existing school health policies and practices study that has been conducted periodically in schools since 1994. Key objectives of such a program could be to, 1, understand nutrition and physical activity practices in early care and education programs. 2, identify the training and technical assistance needs of directors, owners, and staff. And 3, determine how key policies and practices change over time. It would be important for this monitoring program to include child care centers and family homes, as well as Head Start programs. Support and coordination of this monitoring effort should originate with the Secretaries of Agriculture and Health and Human Services to help reduce redundancies that might occur due to existing evaluation requirements. In 2011, 43 researchers and child care leaders participated in a conference sponsored by the NIH, the Robert Wood Johnson Foundation, Nemours, and the Altirum Institute. This meeting identified a number of important research gaps in obesity prevention at child care. Among these were the need to examine the environmental and policy characteristics of ECE programs to determine those characteristics that provide optimal diet and physical activity opportunities for preschoolers, and to evaluate the effectiveness of ECE standards across states. Creation of the early care and education monitoring effort I am proposing would directly address those research gaps. Moving on. Early care and education facilities should provide a robust physical activity program for infants, toddlers, and preschool children that includes sufficient time for child-directed and teacher-directed activities. Also, the facility should encourage child care staff to play an active role in implementing the physical activity program. Attention should also be paid to the importance of play spaces, both outdoors and indoors, and play equipment. All of these recommendations and others not noted are consistent with the IOM's Early Childhood Obesity Prevention Policy Report that was released in 2011. To facilitate the achievement of these recommendations, my second obesity solution opportunity should be implemented. Solution 2, technical assistance provided by child care agencies, public health staffs, and USDA personnel should include a standard message about the type of physical activity program that should be provided for infants, toddlers, and preschoolers in organized child care. As noted in CDC Spectrum of Opportunities, as Debbie presented, technical assistance that can affect obesity in child care settings is currently provided by a number of different resources within states. Technical assistance includes expert advice and guidance to ECE providers to help them improve the quality of their care by changing their practices. Each state has a child care resource and referral agency with professionals who can be easily reached for help and support. Also available within states are child care licensing consultants, and many states have child care health consultants. USDA provides Child and Adult Care Food Program, or CACFP, consultants, as well as cooperative extension agents. Health departments have county and state nutritionists, as well as public health professionals who provide assistance to child care staff. Head Start and Early Head Start programs use consultants to provide pre-service and in-service training to program staff and volunteers. All these individuals should be similarly trained to provide expert assistance through workshops and one-on-one consultations that include a consistent physical activity program message for child care centers and homes. Because no single agency currently provides guidance for physical activity programs in early care and education, as does exist for nutrition through CACFP, a lead agency such as Child Care Aware should be identified to coordinate such an effort. It will be important that low-resourced ECE facilities and those that serve low-income families be provided extra assistance and support toward improvement of their facilities' physical activity program goals. Thank you.